Australia's Prime Minister has turned down a request from the New South Wales government to divert vaccine supplies to the state as it fights a growing COVID-19 outbreak. New South Wales has reported 136 new cases, the biggest daily rise since the current outbreak erupted last month.
We are not going to disrupt the vaccination program around the rest of the country. That vaccination program is going and is hitting as it marks, and we want that to continue.
The state's premier says the situation is a national emergency. Lockdown restrictions will be tightened further. Non-essential workers in some parts of Sydney will be barred from leaving. Sydney has already been under lockdown for a month, but restrictions are likely to be extended. Now, for more on this, Danielle Robertson joins us from Sydney. Danielle, what would declaring a national emergency actually mean for New South Wales?
Yeah, so declaring a national emergency would really consolidate the Commonwealth's powers to respond to the situation. It would also empower ministers to surpass red tape when it comes to legislation. And basically, in layman terms, in this situation, it would mean or could mean more vaccines, and they could come from other states. It could allow, for example, the Pfizer vaccine to be rolled out at the epicentre of the virus, which currently isn't happening. There are limitations on Pfizer. And it could change the entire national vaccination strategy and ultimately contain the current COVID outbreak to where it is now and not allow it to spread any further across the country. But as we heard from the Prime Minister, he has no plans to change the national vaccination program. It's staying as is for now. And other states and territories today flat out said, no, we will not give Sydney our limited supply of vaccines to support them. The only solution was the Prime Minister said they are going to extend the time between the first and the second dose of the Pfizer vaccine, in theory allowing more people to get the first dose and having more people with some layer of protection. But with Sydney now in a ring of steel and with lockdowns within lockdowns here and case numbers still rising, vaccinations are really the only pathway out of restrictions at the moment.
Yes, and with those not being so forthcoming, people are being told to prepare for restrictions to last for months.
Yeah, there are warnings that we could be under these restrictions for at least 2 more months, with lockdowns only seeing case numbers rise, not fall. It does seem the limitations on movements here are going to stick around for a little while. Basically, the Delta variant here is out of control and we can't get a grip on it. Now, the Premier here has been insistent that she will not lift restrictions until the number of cases in the community, while infectious, is close to 0. And epidemiologists are warning that that really isn't feasible at the moment. And with cases still rising and with the state not being able to get a grip on it, it does seem that we are really in this holding pattern between sticking to the lockdowns and waiting for vaccines.
Anyway, thanks for that, Danielle Robertson, speaking to us from Sydney.